Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about false labor. So go ahead, subscribe, and let's get started. So, false labor is something many pregnant women feel, especially in the last few months. It's basically like the stomach tightening on and off. These tightenings are not regular, and most of the time they are not very painful. Maybe just a little uncomfortable. Now, the important thing is, even though it may feel like labor is starting, it's actually not real labor. These contractions won't open the cervix and won't lead to delivery. You can think of it like the body just practicing or getting ready for the actual labor, but the baby is not coming yet. Let's look at the causes of false labor in a simple way. First, one main reason is that the uterus is just preparing for real labor. You can think of it like a practice session where the muscles are getting ready for the actual work. Another common cause is dehydration. When the mother doesn't drink enough water, it can sometimes trigger these contractions. A full bladder can also cause this. If the bladder is not emptied regularly, it can put pressure on the uterus and lead to these tightenings. Physical activity or even too much tiredness can bring on false labor. So if the mother has been walking a lot or is very tired, she might start feeling these contractions. Fetal movements can also play a role. When the baby moves actively, it can sometimes trigger the uterus to tighten. And finally, emotional stress is another factor. If the mother is anxious or stressed, it can also lead to these irregular contractions. So overall, these are all common and harmless reasons, and they don't mean that real labor has started. Now, let's talk about the characteristics of false labor. First thing, the contractions are irregular. That means they don't come at equal intervals. Sometimes they come, sometimes they don't. So there is no proper timing. There is also no fixed pattern. Unlike real labor where contractions follow a rhythm, here everything is unpredictable. The intensity is usually mild, so the mother may feel some tightening or discomfort, but it is not very strong or severe pain. These contractions are mainly felt in the abdomen, so it feels like the stomach is tightening rather than pain starting from the back. Another important point is that they do not increase over time. They don't become more frequent or last longer like true labor contractions. The good thing is they can be relieved easily. If the mother takes rest, drinks water, or changes position, the contractions usually reduce or stop. And finally, there is no change in the cervix. That means no opening or thinning of the cervix is happening, so labor is not actually progressing. Now, let's talk about the signs and symptoms of false labor. So the first thing the mother usually feels is a tightening sensation in the abdomen. It's like the stomach becoming hard for a short time and then relaxing again. This is usually more of a discomfort than real pain. So the mother might say it feels uncomfortable or tight, but not like the strong pain of true labor. Another important point is that these contractions can stop easily. If the mother takes rest, walks a little, or changes her position, the contractions usually go away. Also, there is no show. That means there is no blood-tinged mucus discharge, which we usually expect in true labor. And there is no rupture of membranes. In simple words, the water does not break in false labor. So overall, these signs clearly tell us that it is not real labor. Next, let's see how we identify or diagnose false labor. First, it is mainly based on clinical assessment. That means the doctor or nurse will talk to the mother, ask about the contractions, and observe what she is feeling. Then, during vaginal examination, there will be no cervical dilation. In simple words, the cervix is still closed, which tells us that real labor has not started. Another important thing is monitoring the contraction pattern. When we observe the contractions, we can see that they are irregular and not getting stronger or closer together. So by checking all these things together, we can understand that it is false labor and not true labor. Now let's see what we do in nursing assessment. First, we look at the contractions. We check how often they are coming, how long they last, and how strong they are. This helps us understand whether it looks like false labor or real labor. Then we check the mother's vital signs like pulse, blood pressure, and temperature, just to make sure everything is normal. We also ask about and observe fetal movements. It is important to know if the baby is moving well, because that tells us the baby is okay. Next, we check the hydration status. We see if the mother has been drinking enough water, because dehydration can cause these contractions. And finally, we keep observing for any signs of true labor, so we are always watching if the contractions become regular, stronger, or if there are any new signs like leaking fluid or bleeding. So overall, nursing assessment is mainly about careful observation and making sure both mother and baby are safe. Now let's talk about nursing management. First thing, we should reassure the mother. Many mothers get worried, thinking labor has started. So we need to calmly explain that this is normal and not real labor. Then we encourage rest and changing position. Sometimes just lying down or moving to a different position can reduce the contractions. We should also make sure the mother is drinking enough water. Proper hydration is very important because lack of fluids can trigger these contractions. A warm bath or shower can also help relax the body and reduce the discomfort. Next, we educate the mother about the signs of true labor. This helps her understand when she actually needs to come to the hospital. And if the pregnancy is high risk, we need to monitor more carefully to make sure everything is safe. So overall, the main focus is on comfort, reassurance, and proper guidance. Next, let's talk about health education. First, we should teach the mother how to time contractions. This means showing her how to check how often the contractions are coming and how long they last, so she can understand what is happening. Then we explain the difference between true labor and false labor in a very simple way, so she doesn't get confused or panic. We also need to clearly tell her when she should go to the hospital. For example, if contractions become regular, strong, or if there is leaking of fluid or bleeding. And finally, we encourage her to continue regular antenatal checkups. This helps in monitoring both the mother and baby and keeps everything on track. So overall, health education is about helping the mother feel confident, informed, and less anxious. Now let's understand when we should refer the mother immediately. If the contractions become regular, like coming every 5 to 10 minutes, then we should not ignore it. That can be a sign that true labor has started. If there is rupture of membranes, which means the water breaks, that is also a clear sign to go to the hospital immediately. If the mother has vaginal bleeding, that is not normal and needs urgent attention. If she feels that the baby is moving less than usual, that is also very important and should be reported immediately. And if there is severe abdominal pain, especially strong and continuous pain, we should not wait and should refer immediately. So basically, these are warning signs where we should act quickly and not assume it is just false labor. So, to sum it up in a simple way, false labor is actually a normal part of pregnancy. It usually happens in the later months and helps the uterus get ready for real labor. Even though the mother may feel contractions, these do not lead to delivery. The cervix does not open, so the baby is not going to be born at that time. That's why it is important for us as nurses to assess properly and reassure the mother. Once she understands that this is normal and not dangerous, she will feel more relaxed and confident. So, that's all about false labor. Thank you all for listening. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.